here. There we go. All righty. So welcome to the Just for the Health of It podcast, interviews with our local health experts, hosted by Warren County Public Health. I'm your host, Drew Crawford, a public health educator with Warren County Public Health. And today we're excited to talk with Jeanne Noordsy from Catholic Charities. And we're going to be mainly talking about domestic violence and violence prevention in general. Before we begin, thank you so much for taking your time out of your day to come and speak to me. Really appreciate it. And if you wouldn't mind sharing a little bit about yourself, just interesting facts you have about yourself. Maybe you played water polo in school, or, just like Dr. Malheidi, but whatever you're feeling.
Okay. So, and thank you again. Thank you to Warren County Public Health for creating this avenue for the public to hear more about domestic violence, which is a subject that can be difficult to talk about or to understand. And before I tell you a little bit about myself, let's just tell our listeners the Domestic Violence Project is here for you. We provide services to anyone in Warren and Washington County experiencing domestic violence. And our hotline number is 24-hour hotline 518-793-9496. So I'm going to say it again, 518-793-9496. And I'll just say, we always say this, things that we may talk about today may be hard for some folks to hear. And so please take care of yourself, pause the podcast if you need to, take a break, and reach out to that hotline number if you would like to talk to someone further about domestic violence. Later in the program, I'm going to tell you more about all of what we do at DVP, which is our shorthand for Domestic Violence Project. Okay, so a little bit about me, and I'm basically going to tell you how I got interested in this work.
Absolutely.
Yeah, I don't play water polo, but I do kayak and hike. But I've been working on the issue of domestic violence for 32 years.
Oh, wow.
And I started out of a concern for a friend who had a partner that was kind of scary and controlling, as well as sort of my broader concern for the status of women and how does violence affect the status of women. I started by taking a volunteer training course at the domestic violence program in Saratoga County, and was a volunteer support group leader there. And by the following, that was in 1990, and by the following spring, the agency here in Glens Falls was advertising for a position, which I took and have continued to be on the staff ever since in a couple of different roles. Just to elaborate, you mentioned Catholic Charities is the name of the agency. Our program within Catholic Charities is called Domestic Violence Project of Warren and Washington counties. And then the particular job that I do now is I coordinate something called, here's a mouthful, Domestic Violence Community Coordination Council, the DVCCC. And what I do is bring together police, healthcare, social services, et cetera, so we can work together on community-wide solutions to domestic violence. So that's my particular job there. But the main thing that our staff of 10 does here is our direct services for folks experiencing it. And like I said, you'll hear more about the specifics of how we do that later. So thanks.
Yeah, of course. Well, thank you. Obviously, as you kind of touched upon, domestic violence is a really big issue. It's really, in order to try and solve it, it's going to require a really multi-pronged approach with, there's the medical factors, there's the criminal factors, there's the social work factors. There's a whole lot that goes into it. And a lot of people don't necessarily see that. From our point of view, talking about domestic violence, we're not having the data that we should be having, largely due to the fact that due to the size of our county and the number of cases that we have, it's really hard to kind of report on this data and not give away who the person is. And that's always a big issue when it comes to violence data in general. But for us, the only data that we have going off of this is, 2 assault-related hospitalizations per 10,000 people. which, what does that mean, right? So when we look at this data, we're mainly looking at the CDC or New York State data from behavioral risk surveys. And those numbers were definitely shocking. And the numbers, it seems, have kind of gone up in recent years due to COVID, with the pandemic and, keeping everybody at home, the stay at home, the lockdown orders, those kind of things. But from your point of view, what do you guys see? Like, what kind of statistics are you guys seeing? What things are you guys seeing there at Catholic Charities?
Okay, great. And I think this is a good time. I will mention statistics in a moment to give a sense of prevalence, but I think it's a great time for me to start with, like, what is domestic violence for our listeners? Not
Absolutely.
everyone, we can have a lot of different ideas about what we mean by that term. So I'm going to give you a definition and then try to flesh it out.
No worries.
So domestic violence is a pattern of controlling behaviors, controlling tactics that can include anything from verbal abuse, threats, to sexual and physical violence that one person in a relationship uses to, what we say, gain and maintain power and control over the other. And that can be over an intimate partner. So you sometimes hear the term intimate partner violence, such as a spouse, former spouse, dating partner, or former dating partner. And it's important to know it can still go on. Someone can still be abusive to their ex, or to gain that control over another type of family or household member. And in New York State, our definitions of domestic violence include both intimate partner and another type of family or household member.
Okay.
And so, and it can, we have our notions of who does it happen to, or who does it happen by, and it can happen to anyone of any race, religion, gender, sexual orientation, socioeconomic level, education level, etc. The most common demographic for domestic violence is where women are abused by a male partner. Although, and I'll talk more about why that is in a moment, although abuse occurs, no less often in the LGBTQ plus community, we now recognize. And our agency will serve anyone of any demographic that's experiencing domestic violence. I may say the term victim or survivor. Not everyone identifies with those terms, but it might be a shorthand at times today rather than saying a person experiencing domestic violence, but that's not their whole identity.
Yeah, that is fair.
So I said it's a pattern, and let's talk about some examples within that pattern. Keeping in mind, as I described this doesn't happen on the first date. It's not so obvious. There's a study that showed that an abuser may intentionally wait for the relationship to sort of gel and become more solid before sort of risking acting controlling or abusive. And also, these are just a couple of examples. There's not going to be every example here. But so here's what it might look like to the person experiencing it. Their partner may belittle them, call them names, put them down, humiliate, call them crazy. So this is the verbal. And what does this do? It can sort of wear down someone's sense of self and make them doubt their own perceptions of what's going on. Their partner may punch the wall, knock over a table, break something that was important to them, abuse a pet, display a weapon without using it. And these are pretty intense forms of intimidation. So without actually, I haven't said anything yet about anyone putting a hand on the other person, they can be instilling great fear. Isolation, we see, is a huge form of abuse, where the partner kind of makes all the rules and says where you can go and what you can wear and who you can talk to. This can start out looking flattering, especially we see teen dating violence is simply domestic violence happening in teen dating years. And it can start with like, oh, he wants to spend all his time with me. And then it turns into, 5 million texts, where are you? And you need to check in all the time. And that happens at any age, teen and older. We've seen where the abusive person will look at the odometer and you can't go any more miles than, where I said you could go to the store.
Mhm.
And of course, this wears down, and breaks down someone's connections and sources of support with other family and friends, and isolates them from any voice other than the abuser's voice about what's going on.
Mhm.
Economically, their partner may prevent them from getting or keeping a job. We've seen where the abuser cut up her work uniforms or hid her car keys when it was time to go to work, and sabotage the job. And this is a form of economic abuse, trying to remove economic independence of that person. So all these are ways that someone's getting further entrapped. Couple more, and then we'll wrap up this part. Threats. There's a lot of threats, especially having to do with, if you tell anyone, if you go to the police, here's what I'm going to do. Again, threatening verbally, but very scary. Their partner may sexually force or coerce them to do things they don't want to do. And finally, after all that, their partner may do something, physical violence, and of course, sexual is also physical violence, but including, pushing, restraining, pushing up against the wall, hitting, or this is a very serious form of abuse, putting their hands around their partner's neck and applying pressure, which technically we know as strangulation, although many people call it choking. And it's a dangerous form of abuse. I got to take a sip of water. And domestic violence can be fatal. So you'll notice it wasn't until the last few things I described that there was physical abuse, because fear can be instilled in many ways, and that's how abuse works. Is that if I'm afraid or confused, intimidated by another person, I'm more likely to go along with what they want me to do or don't want to do. That's kind of how entrapment works. And we often see, the abusive person having a sense of entitlement to have that control over the other.
Mhm.
But it doesn't happen all the time. It could be sprinkled in with other times when the partner is attentive, so we might say loving, but maybe it's not necessarily loving, but attentive, maybe apologetic. And that's very confusing for the person experiencing it, and kind of keeps them engaged. And we know that trying to leave an abusive partner is the most dangerous time. We certainly help people do it all the time, but we have to know that we can't just say to someone, yeah, why don't you just pick up and leave? It's the time when the most, domestic violence, homicide occurs, because you're stepping out from under that person's control who wants to keep control.
Mhm.
So it's a big
Yeah.
threat to that person's control.
Mhm. Definitely. And I mean, to kind of go back to how COVID-19 kind of impacted the situation, we saw a huge number of increases in not domestic violence calls, but due to the lethality of the cases, you're seeing a lot more people reaching out. As multiple studies have shown, the more time that you're spent inside, the more time you're more stressed out with economic instability. Some people are losing jobs during the pandemic, and that really translated to the severity of domestic violence and violence in any form. You also touched upon high school students, and it's something that we don't really get an awful lot of data for, again. But the CDC does do a behavioral risk youth survey. And what we found when we transformed that data for Warren County was that over 50% of students would be experiencing violence in some form if the numbers stayed the same. In total, 1,597 students in Warren County would be experiencing violence in some form. This violence could be, bullying, it could be dating violence, it could be sexual assault, it could be all sorts of different things. And I think that's always the biggest aspect that a lot of people miss, is when it comes to, domestic violence. As you said, it's a cycle. And it doesn't have to be strictly physical. It can be, mental, it can be verbal. And I think with, the lockdown orders, a new virus going around, there was a lot of factors that were at play to see the increase in the domestic violence calls and cases. And, you guys are one of the leading areas in our county for domestic violence. So if there's somebody to ask about how the pandemic affected, it's definitely going to be you guys. And, what do you see and what do you hear about domestic violence? Is the data that other, the nations and countries are pulling together, is it following the same sort of pattern at a local level, do you think?
Yeah, so let me start by saying the CDC has studied this for years, and nationally says 1 in 4 women in their lifetime will experience one of the more serious forms of domestic violence. So they counted it as sexual violence, physical violence, and or stalking by an intimate partner, 1 in 4. So that means that if we're talking about the broader forms of abuse, including non-physical or sexual, the numbers are clearly higher than 1 in 4. And yes, that again, that can be just as prevalent for folks in a same-sex relationship. Men can be abused as well, most often at the hands of other men, due to our gender norms, which we're going to talk a little bit more about. But yes, we are very busy locally, and not only during the pandemic. I will say something about the pandemic, but yes, for all the 32 years I've been here, we are busy all the time. Our shelters runs full a lot of the time. It's true when you talked at the beginning about how, you have this data of like 2 hospitalizations per 10,000 people. But that's because, people can instill fear by doing lots of other things that don't require hospitalization. That's one of the reasons strangulation is so dangerous and is a red flag for homicide. Because as the prosecutor said to me the other day, the only reason to put your hands around someone's neck and apply pressure is to, send the message like, I control whether you live or die. Because it only takes a certain number of pounds of pressure for a certain number of seconds. And somebody will often, abusive person will often do that enough to, really terrorize the other person and then stop. And so, then the police come, and we passed a strangulation law a number of years ago in New York, because prior to that, all they could charge was like harassment, because there would be no marks. Strangulation barely leaves any marks. Over time, we've learned more that it creates these red dots because your blood flow is being cut off. So you can have blood spots in your eyes called petechiae and different things. So we're learning to recognize it, but it would look like very little injury. People should know that there can be very dangerous internal injury from a strangulation incident. And it is really important for people to get checked out the hospital, because they can have like a separated, I'm not the medical person, but thing going on in there that can be like fatal a couple of days later. But anyway, the kind of assault that requires hospitalization is going to be more rare, because fear can be instilled through lots of other, so most of it happens at the misdemeanor level when you talk from the criminal justice perspective. So we started talking about this in the DVCCC a couple of years ago. How do you count it? And the police brought in some of their numbers. We brought in some of our numbers, and they're all different numbers, because not everybody who comes here is also going to go to police or go to the hospital. But it's basically a very underreported crime. But we know, because of how shelters in New York can't keep up with the demand for shelter space, we're constantly calling other counties to find out, do you have space? We have some family that needs shelter. And yes, people were trapped at home. Some were essential workers that were continuing to work. Some lost their jobs. Some were doing the kind of jobs where you work from home. But in general, more people were more isolated and more trapped, at home with an abuser. And we heard about that a lot. And people had greater needs for food and other essentials too during the pandemic. Some of our sources, we had more referrals, like Child Protective Services. Other sources like schools, because kids weren't going to school in person, we were seeing less referrals. But the part about, the economic pressure on people during the pandemic, there's a lot of myths around domestic violence, around, it being caused by certain stresses. And it's important to know, like, many people had economic stresses during the pandemic and didn't take it out on their partner.
Absolutely.
So that we don't want to call it like a cause. or a trigger, but sometimes it's an excuse. But that, going back to that sort of, if someone believes they're entitled to power and control, they use lots of things as an excuse. And that could be one of them. So, but I will say over the years, when I say to someone what I do for work, they'll say, oh, is there a lot of domestic violence around here? Kind of like surprised that there was a need for a domestic violence program in kind of sleepy upstate New York. But the reality is it's everywhere. Every county in New York has a domestic violence program by law. Every county must, every state in New York. So this is just in every community, and it has to do with the fabric of our society, as I'm going to say more about in a minute.
Yeah, no worries. And it's, we discussed a little bit on what you're seeing contributing to domestic violence. Is there anything else other than, the stay-at-home orders, the, other factors that can contribute? Is there anything else that you wanted to point out that often goes under the radar that some people may need to look out for?
As far as what the impact of the pandemic was?
As far as just impacts that can put you at an increased risk for domestic violence or violence of any form, whether it's, for us, social determinants of health is something that we always look at, we discussed a little bit earlier, we talked about how if a child is seeing that's how mom and dad treat each other, then the child is going to be raised in a way where, they're gonna assume that's what everybody else's parents are doing. And that's how relationships work, which, witnessing as a child alone has massive impacts physically, mentally, economically, socially, all different ways. It can lead to, stunting of the growth. It can lead to behavioral health issues, distrust of people and caregivers, or distrust of people in other relationships with them. You can have issues of depression, anxiety, unsafe abortions, even unwanted pregnancies. You can have STIs. There is a whole slew of factors, and effects that can happen on a child that witnesses that stuff. But what other factors are at play? What kind of other things are you seeing that kind of contribute to the rise in domestic violence that we're seeing now?
Yeah, and I'm not totally convinced that it's I'm not sure if it's a rise or, it's sort of how it played out during the pandemic, because we've had a high rate of domestic violence for decades. But we did see more. The New York State hotline did report an increase in calls to the domestic violence hotline in 2020 over 2019, and that, reflecting the pandemic. And I don't mean to say that there wasn't a huge impact, but just in terms of looking at domestic violence as an issue that has gone on for a long time, and we need to continue to be aware of it now. So what are the factors? Yes, we do see it as a learned behavior, as you mentioned, and people can be at risk, especially young males can be at risk of learning that behavior from a father or uncle, et cetera, or from the society at large, in terms of attitudes towards women and girls. And I think it's important to look at the intersectionality of oppression. So as I've said, it cuts across all demographic groups. At the same time, if there's someone who's more at risk of, as you said, the social determinants of health, more at risk of not being able to access services, whether that's an immigrant woman, whether that's an LGBTQ person, whether that is a person of color that's experiencing racism, that these intersectionalities, it doesn't mean there's more domestic violence in that group. It can mean that there's a more difficulty accessing a response, And so that can leave that person more at risk going forward.
Mhm.
So those are some of the important things to look at. Also, we know that research is saying that young women are at very high risk, from like teenage to
Mhm.
20s. So,
Absolutely. Yeah, definitely.
okay.
Yeah. Alrighty. Well, so, we're talking about the many different factors. You talked about how it can be a learned behavior. There's, all these other things that come into it. And with that, there always leads the, well, so why don't we fix it? Right? Why don't we fix it? And what kind of barriers do you see that come into play when talking about domestic violence? I know that it's a very uncomfortable conversation for some, and it's not an easy topic to kind of just address for a lot of people. And so, from our point of view, whenever we try to talk about these things, it has to be done in a very controlled way, and you have to have training, you have to have everything behind it in order to even begin to navigate that conversation. But that's kind of our barrier. We're not able to see the impacts. We're not able to have the data that will justify us going into these communities. And so for you, what do you see as the big impacts, whether it's impacts that prevent us from being involved, impacts that prevent the community being involved? What kind of factors are there that play into not being able to solve this issue?
Okay. So I realized I think I missed a prompt there of what I'm going to say something else
No
on
worries.
the causes and where does it come from piece that I think was what you were just asking me before, and before I go to the barriers.
Mhm.
So in talking about, I think you're asking what contributes to the issue, and I missed that was where I was supposed to
No
say
worries.
something. So yeah, it's really important, I think, to say a little bit more about root causes, and so, which leads us to the barriers too. But you will hear the term gender-based violence used sometimes, and that sometimes is used to refer to a cluster of crimes against women, including domestic violence, sexual assault, and sex trafficking, where women against women and others, but where like women are targeted with these crimes more than anyone else.
Mhm.
And there are roots in our culture of why this is so, in terms of gender norms going back eons. And to give you an example of the sort of the legal and social history that we have defining roles for people by gender, here's an example. In Old English common law, there was a rule called the rule of thumb. And the rule of thumb is that a man may beat his wife with a husband may beat his wife with a stick no thicker than his thumb. And there was some controversy about whether that was so, but I found in a law book a judge in the colonies in the United States, where some of our law had been built on Old English common law, that referred to that law.
Wow.
And so what we see from that, and because at that time, of course, wives are the property of husbands. Husbands were not only allowed, but encouraged to chastise their wives. That was the term. And so you see from something like rule of thumb, the condoning, how it's inside the norm, not outside the norm. Just like, you may drive your car, driving your car is allowed, just don't drive faster than 65 miles an hour, right? So it's totally acceptable. And sort of like the appearance of some reform by saying, well, now we're not going to let you use a stick any thicker than your thumb. But you can obviously do a lot of damage with that size of a stick.
Mhm.
And that's true all around the world, not only England. There was a saying in China, a woman is like a gong. She doesn't work unless she's hit, and many, many like that. And so it's hard to change those norms. And we say it's only been 100 years since women had the right to vote. And 100 years might seem like a long time, but it's not long in this whole history that goes back thousands of years. It's only been a while since it's only been a few decades since some other progress has happened for women's status. And so this notion of it being inside the norm for husband to be able to abuse their wife is hard to undo, and we're still trying to undo the norms. And any sort of public health issue, we talk about, social norms being knowledge, attitudes, beliefs, and behaviors. It takes a long time, and some of that is still hanging on. And it's in terms of same-sex relationships, it can certainly occur there as well, because once we have these dynamics in our society of the permission to have power over another, it can get acted out in any type of relationship. It's important here. It's always important for me. I have many men in my life that I love, and my brothers and my nephews. Men are good. Men and boys are good. Men are not the problem. All human beings are good in my belief system. But it's the socialization into an oppressive system, and which happens with racism and happens with sexism and so on. So that's the socialization that is a core of the root cause. And so that's an important piece to understand when we're approaching it. And I guess that leads me to your question about barriers. I think that for me, the most important thing I want to say, I mean, anyone could be listening to this program, including professionals or the general public, but I'll say first in terms, I think maybe, the general public will be the first I'll try to speak to, is that there definitely is a big misunderstanding that the problem of domestic violence is something wrong with the person who's experiencing it, the victim or the survivor. Something's wrong with them that's making them make bad choices. And all that, putting energy into that line of thinking, I just implore everybody to just take that energy and put it into thinking about, why is the abusive person, why are they doing that? Mm-hmm. Why are they allowed to get away with it? What is going on in our society that is still going on? It is still a socialization of some people to believe they have that right. What can we do as a community to stop it? So anything we can do to sort of, because believe me, victims of domestic violence are trapped and are between a rock and a hard place. And there's a lot we can do to provide support, but it's never makes any sense to use our energy sort of critiquing that person and thinking that the way to stop domestic violence is to teach them to do something different, because the abuser is just going to go on and find another person. Yep. And it's natural for any human to think, well, I wouldn't allow myself to be in that situation, because we psychologically don't want to think it could happen to us. But it's really important in terms of shifting that thinking and putting our energy toward the other way. So I think for me, that's the biggest barrier, as well as things like, for any professionals out there, we've heard from clergy or lawyers who say, I never learned anything about domestic violence when I was in seminary or law school. And that's changing little by little. And that's really important, because all those helping professionals, domestic survivors, are not only going to turn to me and you, they're going to turn to their hairdresser and their clergy and their counselor and lots of other people besides domestic violence programs. So we all need that training. So that's something really important.
Mm-hmm. Yeah, absolutely. And as we're talking, you pointed out that there was such a societal shift, really, and I think that's something really important to kind of bring out, that it really wasn't too long ago where this was kind of socially accepted, like you said. And from my point of view, like when I was in school, we never really talked about domestic violence. I never really had an experience with domestic violence. But now, being in a position where I'm talking to people about domestic violence, I'm realizing how much more widespread it is, not just, in the world or globally, but even right here in our own backyard. You're hearing more and more stories, you're talking to more and more people about it. And it's really kind of crazy to think that, from my point of view, being in a younger generation where it was kind of, oh boy, there we go. All right. Oh no, cancel, let's do that. All right, there we go. All right. Sorry, just got to pop up. But yeah, from our point of view, we're not in the younger generation, we don't talk about domestic violence as much because from our point of view, it seems like common sense, you know, don't treat somebody else the way that you wouldn't want to be treated. But, you know, I think it's a great point that you bring where, you know, it really wasn't that long ago before we kind of shifted out of, okay, this isn't okay. We kind of need to go into a completely different direction. You know, these are human beings as well. This is, you know, and I think that's definitely something that not a lot of people think about. From your point of view, you know, what do you say is kind of the biggest issue? Would it be more of a misinformation? People don't realize that it's such an issue here in the county? Is it a lack of engagement where people do realize that's an issue, but like you said, where, oh, it's not going to happen to me, so I'm not going to try for it. I'm not going to try and support. Or is it more along things that, you know, you're lacking of support from the people because they don't think that it's that big of an issue? What kind of barriers from the county itself are you experiencing more of?
From the county itself?
From the county itself, whether it's just the general population, from the government, from our local health department, what are more of the bigger issues? And please don't be afraid to be honest, you know, it's really okay.
I mean, I guess when I think of the county, you know, we always say the county when we mean, you know, social services and family court and, you know, everybody. And so, and we work really closely with the county in both Warren and Washington County. I'm not sure in terms of barriers. I mean, I guess I think, yeah, it's just like, it's certainly recommended that everybody get training annually. And that's something I think we could do more. You know, like sometimes we've done a domestic violence training for an organization, but then we might not do another one for 10 years or something. And I think that would be great that we just make sure, you know, it's like somebody said the other day, training is perishable. It has to be renewed all the time.
Yep.
And so, yeah, I just think like the willingness for everyone in professional roles, which so many are, and we're very happy for the working relationships that we have, you know, for everyone to just be on board with, let's keep working on this. And as one of my friends in the police realm says, like something like, we can have thick skin. We don't have to be defensive about, you know, fault finding or finger pointing or anything. We can just all keep helping each other do a better job. Is this the same question about how to resolve, or is that the next question?
I think we're going to be going to, I think that's the one that we're going to go to. You know, while we're on it, you know, how do you see it being resolved? You know, is it going to be more of a policy issue? Is it the lack of resources that we may have? Are the resources we have not robust enough for the amount of volume that we're getting? Is there a lack of education, recognizing the signs of domestic violence, recognizing it, whether I'm in the situation or I know somebody who is in the situation? What kind of areas do you see are, I guess, which areas do you think are the most important for us to kind of focus on, whether it's the policy, resource, or education piece?
So let me say sort of a big picture, which might not be all something public health can do, but what we can do as a coordinated community response, which is, you know, how we describe our DVCCC and other task forces like it across the country, that we're coordinated community response, bringing together all those sectors. And so it's certainly been recognized that in terms of stopping domestic violence, that we need to do both deterrence and prevention. And, you know, what is deterrence? It's consequences for the abusive person that are serious enough to, in theory, make them not want to have to face those consequences again. Doesn't work for every abuser, but that, you know, there can be, when the actions have been illegal, certainly we want to see arrest, prosecution, sentencing, probation. You know, what are the things that make it fines? What are the things that, like, oh, that hurt me in my pocket, I don't want to do that again. So that's deterrence. It's the community holding the offender accountable. And, you know, two main themes of an effective community response are offender accountability and victim safety. So offender accountability is in the deterrence part. Also, there's some abusive actions where there might not be a criminal justice consequence that's possible, because it might not have crossed the line into a crime. But accountability is also messaging, and this is something we can all do and public health can do. The messaging that the domestic violence is not okay. And we call this like having a zero tolerance ethic. There's lots of posters out there. I have lots of them I can pass on to anyone who wants to hang them up in their office, about zero tolerance for domestic violence. As a community, we say it's not okay. And leaders from, clergy to employers and counselors, someone who say the clergy person of someone who's abusive or the employer of someone who's abusive, where it's known that that's going on, can create consequences related to their employment or related to, their safety things, like you can't attend church at the same time she's attending church, rather than some of the outdated notions coming from religion were more like, oh, we can't separate the family and that kind of thing. But to understand, that already the promise to love the other person was broken, by the abuse, and holding the person accountable is important. Child welfare, CPS workers that work with both a mother and a father. There's lots of people in the position to send a message of accountability, holding that person accountable, not slipping into any kind of jokes or any kind of, making light of it. And so that's all things we can do as a community to have a zero tolerance ethic. And then prevention. What is prevention? Primary prevention is changing the conditions in the society to prevent something from ever happening in the first place, right? We do that with lots of other public health issues. And so, as I mentioned, changing the social norms is, we've worked on that. We had 10 years where we were funded by a project called the Delta Project that came out of the CDC that was assisting us to work with our community on, how can we change social norms to prevent violence against women or against any intimate partner from it, make it unthinkable, And so there's a lot of great programs that are going on all across the nation and internationally to engage men and boys in this, men being mentors to boys. One of them is called Coaching Boys into Men. And that is a model that comes out of an organization called Futures Without Violence in San Francisco. Coaching Boys into Men is a model for coaches, kind of a tool book for them to relay to their team members in middle school and high school, like 8 different lessons that over the course of the sport season that they could relay about respect for women and girls. So so primary prevention is about, let's model what we want to see. Let's model relationships built on respect and egalitarianism, equality. So we're modeling what we do want to see. We can also talk about what we don't want to see, like that zero tolerance, but primary prevention, you're modeling what you do want to see. And so there's lots of great stuff going on across the country there. And then resources, you mentioned that, are there enough resources? We need to put our money where our mouth is more about domestic violence. Certainly, over 50, if we compare to 50 years ago when there was no funding for shelters at all, we've come a long way. But we need to do so much more. Affordable housing, we know, is a huge problem for the community anyway. But when you look at the fact that the main cause of homelessness for women is domestic violence, it's such an intersecting issue. One of the reasons that folks who come and stay in our shelter, one of the biggest problems for them to get to the point to be able to exit the shelter and live on their own again is trying to find affordable housing. So you sort of become homeless by default if you're moving out from under, living with an abusive person. Unless you have family or friends or somewhere to go, you become homeless, at least temporarily, till you can find a place to go. So that's a huge issue. Legal services for survivors, we need a lot more, practical resources for survivors that have a lot of barriers to leaving.
Mhm.
As far as public policy, we've come a long way in New York with the laws that we've passed. In the old days, police were trained to do mediate and separate, get the parties apart. What was the argument about, which we know the violence is not really about the argument, but that was the old training. Tell someone to walk around the block. Now there's mandatory arrest for misdemeanors and felonies. We've passed many laws, the stalking law, the strangulation law, as I mentioned, and like extending the length of a court order of protection. Our laws have expanded, things like that. We still need more laws that we're working on. There's a law for training some of the folks who work in doing the custody evaluations for family court. There's a law being proposed for that. More access to crime victim compensation for victims who've had to pay out of pocket for changing the locks on the doors and things like that. So public policy is a big piece, and we work on that every year. We work on that and talk to our legislators about the laws that we want to see.
Mhm. Absolutely, and that's a really big topic that you address. I feel like policy should definitely be there, and resources in general. Granted, we are a little bit more of a rural community, but resources in general for anything related to support, whether it's mental health support, STD, STI support, all these different things, is definitely something that we need to focus on as a county more. And domestic violence is all the same. Violence prevention, being not only there to help a person move out of that situation and, be there, but also as a way to support them, which kind of leads into my next point. And I'm probably going to ask this question a few times, but, just depending on the audience, do you have any words, tips, or advice for somebody that may be experiencing domestic violence and how to get out of that situation? What are some words, tips, and advice you would give to them?
I think it's a great opportunity for me to tell our listeners more about our domestic violence project, what we do, in addition to that hotline number we mentioned before. And I'll say the number again, 518-793-9496. So I want to let people know that the services are free and confidential and voluntary. People can call anonymously if they choose to. They can meet with an advocate. We do some things more remotely since the pandemic. We can do phone or Zoom, or they can come in person. What we do here, we see the survivor as the expert on their situation, because nobody knows for that person. Is it going to be safer to leave? Is it going to be safer to get an order of protection? Is it, do they need to wait until the kids graduate from school next year? And so what we're about is helping someone know about their rights and their options, and then legal options and other options, and then helping them kind of sort it out and figure out what's the best safety plan for them. So we're never telling anybody what to do, but providing support towards things that might help the person be safer. We have support group, so folks can meet others confidentially who are going through it and get support from each other. We have the shelter, which is a temporary safe place for survivors and their children to stay. And our brochures are out there all over the county, in the county buildings and the library. So I hope that that folks can find our brochures, or we're online. We developed a website within the last year. So we want to let people know that we're here. And I guess the words of advice would be, it's not your fault, you're not alone, and help is available. It's like I said before, how it's important not to judge someone. And, the whole concept of leaving, it is, we have to remember, like, yes, we can do lots of things to help somebody move out of that particular home. That doesn't mean that the abuser won't stop the abuse. but we
Mhm.
will, that we have to be clear. It doesn't mean the end of it. A lot of times the abuser's not ready to let go of the relationship, and they'll continue to stalk and abuse and, use technology to, over Facebook and email, and do lots of things to continue to try to frighten the person. And so we'll do everything we can to help people make a safety plan. Even a post-exit safety plan is almost, more common thing that we have to do. And so I would say to people, you may be getting a lot of judgment coming at you from people who mean well but don't quite understand. And, it's not your fault. And that the people on our hotline are trained to be completely non-judgmental and supportive and help you figure it out. So we hope that we might be able to be of assistance. But it's not, somebody might have a sister or someone else who's helpful to them. They don't have to call us if they have somebody else who's helping them, but we're here. And if it's happening to a loved one, I want to say this too, this tip, to remain unconditionally supportive. If you condition your support, like, well, if you don't leave that person, I'm not your friend anymore, or I won't help you anymore. Oh, I helped you before and you went back. Because it may take a number of times. A lot of times an abusive person will promise to change. And there's nothing wrong with believing that promise, because you want to believe that promise. That's what you want. You want to keep your family together. It's the fault of the person breaking the promise, not the fault of the person who believed it. But anyway, so try to be unconditionally supportive, because there might be a lot of ups and downs, and that's part of it. But you can keep it confidential. So you don't want anything that your friend confided to you, you don't want to tell that could endanger them. And you want to just kind of focus on how can I help and listen.
Mhm.
And there is a resource, I'm just going to mention one more thing. There's a resource called How to Be an Ally to a Loved One Experiencing Domestic Violence, which is excellent. And it's on a website called, don't be confused by this name. The website is Safe and Together Institute. Together, Safe and Together is about keeping children together with a non-offending parent. It's not about trying to keep tell the victim to stay together with the abuser. It's a project that started with Child Protective Services and how to work towards the goal of keeping children rather than removing children to foster care. So the website is called Safe and Together. And if you go there, you can Google it. This How to Be an Ally to a Loved One is excellent, not only for friends and family, it's also excellent for professionals, actually. It has a lot of good information about how to be supportive and non-judgmental, and give the person that's going through it, positive feedback about how well they're doing every day, trying to survive, because they is really important, rather than criticizing what they did or didn't do. So
Yeah, absolutely. And like we said, this is a very multi-pronged issue. There's so many different ways. There's the criminal justice area, there's the social work area, there's the individual and societal area. There's a lot of things to go into it. And hopefully after a little bit of discussion with this, anybody who's listening and watching, kind of feels a little bit better about it. You never realize how big of an issue it really is until you start digging in. And that's definitely one thing that I'm learning as I go through these podcasts with all these topics, that there's some big topics, and there's a lot more in depth to it than previously. But as we're wrapping up, is there anything that you didn't get to quite touch upon that you want to get out there? Is there anything that we missed that you would like to address? Is there anything else?
I want to thank Public Health, because there's a representative of Public Health that attends the DVCCC. Public Health has included us at health fairs. Public Health in both counties have, put information on your website. And so we want to thank you, because you're doing a lot. And I just encourage, I think you asked before, what can Public Health do? Continue to talk about domestic violence as part of your other programs, like the maternal and child health program, since that, is going to be a place where we're going to see more women.
Absolutely.
And so I think that, you know, you're really an ally to us, and thank you, and keep it up.
Well, of course. And, you know, thank you so much. Obviously, you know, we know that you guys are real busy right now. So, you know, taking the time out of your day to kind of sit on this podcast and talk to me about the topic here at hand with domestic violence, I really appreciate it. And it's definitely something that we're going to have to keep moving forward on and keep talking and collaborating on. You know, we really enjoy your guys' input from an expert perspective. And even just from a community perspective, you guys have really, you know, like I said at the beginning, you guys are the forefront for domestic violence support in our county and in our area, which doesn't quite get the attention or recognition that it honestly deserves at this point. You guys have helped us through the entire pandemic. You guys have helped us with years and years before that. And you guys have really been, like I said, the expert in the area, in the field, and we really appreciate all of your guys' support, all the work that you guys are doing. You guys are changing lives day in and day out, and we really can't thank you guys enough. So thank you so much. And as we finish on here, thank you so much, Jeanne. I'm your host, Drew Crawford, Warren County Public Health, and I'll see you guys. Thank you for listening. Be safe, be healthy, and we'll see you all tomorrow. Thank you.